Hello and welcome to Phoenix. We are here at the annual meeting of AHRA, the Association for Medical Imaging Management. My name is Brian Casey, Editor-in-Chief of AmpMini.com. We're here with Mark Lerner. He is a recruiter with PSI Recruiters in Washington, D.C. Mark, thanks for being with us today.
Well, thanks for having me today, Brian.
Yeah. So you gave a talk today about the importance of quality improvement in radiology. Can you summarize a few of the topics that you talked about there?
Yeah, well, I start my talk with some stories, one of which is the story of a child who died in a hospital due to a overdose of medication. His family was in a car accident, and he was brought to a hospital where he was developing seizures, and a pharmacist, 20-year pharmacist, administered an adult dose of a seizure medication and immediately stopped the baby's heart.
Oh, dear.
I also tell the story in contrast of actually a friend of mine, Brett Baer. He's a newscaster at Fox News national level, and he had a child at a Washington, D.C. facility that nearly died. The child had 5 congenital heart defects, and if it was not for a nurse that insisted that this baby receive follow-up care when everyone around the baby thought everything was perfect, this child who turned 12 the other day would not be around. Mm-hmm. And so it's these type of stories I use to demonstrate that quality control or performance improvement in healthcare is crucial.
Sure.
And I think it really is the most important topic of the Aspiring Leaders program that I talk about, the AHRA. So we use those stories to talk about how to improve things for patients that come through radiology departments, and mostly it's around the use of Lean Six Sigma, process improvement technique that's really kind of fun to do. I've done many projects throughout my career. And one of them that I spend considerable time on is we actually at one of my facilities cut the time to complete an inpatient MRI in half by 50%.
Yeah.
And I go through how in a structured process, you can take really anything in a healthcare facility and reduce it by 30 to 50% if you follow the strict outlines that are part of the Lean Six Sigma process. Yeah. So we talk about that. We talk about ways to reduce errors in healthcare. I've administered what I called an adverse event index program, which actually counts the days between adverse patient events, and it tends to focus people around the systems and processes they can use to cut out these errors from happening. And over the years, I mean, we've made hundreds of improvements based upon this program, very similar to a nursing unit that counts the days between Claudia or Claudia infections, and or in a construction site where you go by and you see 50 days without an accident. It's very similar to that. So I think that if healthcare facilities are seeing frequent patient safety issues, they should consider doing something like an adverse event index program, and I can certainly help anyone who needs information about that.
Now, are these things difficult to do? I mean, everybody's really busy, radiology administrators, we're running around.
No, it really isn't. Once you get a culture of safety built into your department, and I think people look forward to, for example, a weekly Lean Six Sigma meeting, or they want to know what the adverse event index count is, or they want to see if patients are sending letters that are, supporting the staff and talking about the positive experience they've had in the department. So all of these things, no, I don't think they're complicated. I just think it takes a focus and, the idea that you really want to make things better for patients.
And healthcare in general is really coming around to this idea that it's a customer service business and that patient satisfaction is really important.
It is. And I think we've done a lot of work around patient satisfaction, but we can do a lot more.
Awesome.
And I think meeting the needs of patients is something we can work on a daily basis.
Great. Well, that's a great way to close. Mark, thanks so much for being with us.
Thanks for talking to me.
Yeah. Signing off from Phoenix, my name is Brian Casey.